Hello everybody, I'm Jan Owens and this is my annual report to members on the activities of the Council of Governors in 2020. This is my third and final report as I retire after this meeting, so I thought I would reflect briefly on the last 3 years and then I'll tell you how tough this year has been. When I was elected as lead governor 3 years ago, the Council was clear about its role and responsibilities in holding the Board of Directors to account, and we'd begun to think about our other main task in engaging with our membership and our public. So when I became lead governor, we started a members' quarterly newsletter with the aim of getting information published about the services provided by the Trust and developments that were being made. And I hope that's now meeting your requirements for useful information and updates. At the same time, we wanted to meet face to face with members of the public and yourselves to hear your views and to report them back to the executive. We started with a really successful meeting in Blandford in 2018 on pain management, and this encouraged us as governors to put on more public meetings. So early in 2019, we ran 3 public meetings in Weymouth, Sturminster Newton and Poole, asking people how they rated Dorset Healthcare Services and what more they would like from us. The overwhelming view was that people wanted more information about what services are available and how to access them. They were also concerned about the transport difficulties in reaching appointments in rural areas and asking the Trust to consider the transport required when moving any services to new sites or developing new services. These views were fed into the new Trust strategy, which is just about to be republished, taking account of the changes made as a result of the COVID pandemic. And I'd recommend that you read it, as it really shows clearly the direction of travel for the community and mental health services in our area for the next 5 years. So, building on that success of the public engagement meetings that we'd held, the Council planned to hold regular meetings throughout this year in different locations across our patch. The idea was to focus on the most significant health needs for that community and to have local clinicians talk about the services that they run. I am so disappointed that COVID shutdown stopped this from happening, and I really hope that the Council will ensure that this engagement will be resumed as soon as possible. So, moving on to the story of this year, it's certainly been tough for all of us, and certainly disappointing for me and the governors. It seems amazing to think at this time last year we hadn't heard of COVID, and now it feels as though it controls our whole lives. Our work as governors stopped completely for a couple of months to allow the senior managers to rework the Trust services and to reposition staff to meet the crisis. Everything went online, and many of us were working from home in relative isolation. Our corporate and our individual learning curve in digital technology had begun, and I'm pleased to report that governors are doing well with it, and it's had some positive benefits, like not having to drive all over the county for meetings, but most of us have missed the contact with others, which binds us together and means that working cooperatively is less easy. As the lockdown eased, the governors became increasingly concerned that we need to exercise our responsibility in holding the board to account for the performance of the Trust. The Board of Directors began meeting again virtually, and governors were able to watch the proceedings and eventually were able to question and comment as usual at the ending of the meetings. The Council itself began virtual meetings at the end of May. The months June and July seemed particularly hard, learning the lessons from the COVID crisis and trying to anticipate its effects longer term, what services needed to be provided, how they could be delivered, whilst ensuring that all our essential services were continuing to meet the needs of the patients. We knew that patients found the increased use of online technology to access health services was better for some and worse for others. Some felt the benefits of the ease of access, but others found it off-putting and difficult. And governors have consistently raised the need for the Trust to provide patients with the choice of phone and digital access to services, but also ensure that there is access to clinicians face-to-face when necessary. In truth, the increasing digitalisation was always the way the NHS was moving as a whole, but the pandemic has speeded up that transformation, which is the theme of the meeting today. The last board meeting that governors attended this September was excellent. The Trust strategy, with all its supporting strategies for the workforce, for finances, for sustainability and digital, are all set out as a clear direction for the Trust, which will be underpinned by the outcomes required and their timescales. The board members, both executives and non-executives, were working well together, and it felt like the board was demonstrating the kind of leadership required for this essential part of the health service, namely the support for the people in our local communities who require care in their own homes or as close to it as possible. On behalf of the Council, I'd like to thank the board, who have all made great contributions towards this Trust being rated outstanding by the Care Quality Commission. The Council of Governors have been actively working with board members to identify the skills needed to strengthen the board and have been involved in running an extensive recruitment campaign. The Council considers that in making appointments to the board, it will be able to continue to lead Dorset Healthcare in a robust and sensitive way. So, in coming to the end of my third and final year as lead governor, I feel satisfied that the Council has carried out its duty in holding the board to account to the best of its ability. Now, in terms of the Council's responsibility to the Trust membership, I have to report that the number of public members has increased by 8% and now stands at 5,296, and that's in addition to the staff. So our total membership stands at 12,906 for this year. It's good to see that increase in membership and illustrates that the Council's membership strategy is working. Some of it has to be attributed to the massive amount of work put in by our membership manager, Jacqueline Stratford. She has been absolute linchpin between members and governors. She's supported all the governors with ideas and information and advice, and she's always so calm and positive. I couldn't have done my job as lead governor without her. And she invites all members to keep in contact with her and let her know of any issues they have. My thanks also to our 6 staff governors for the work that they've done with our staff over this year. They've explained their role, they've promoted it, and taken up staff concerns with the chair of the Trust and the Council. They're the eyes and the ears of the Council, and they've kept us aware of what's happening on the front line, both in terms of staff care and services. They've been exemplary. We're now losing one of our longest serving governors, Pete Kelsall, who has 9 years experience as staff governors and the scars to prove it, and he would be really hard to replace. I'm afraid I can't announce the 2 new staff governors or even the public governors, as the election results haven't reached me yet, but the chairman will be announcing the results, which will be in the members' newsletter and on the Trust website for everyone to see. Just to let you know, the Council is undertaking its own transformation. As the role of lead governor has grown so much over the past 3 years, it makes sense for the work to be carried out more collaboratively. There will be one governor with the title lead governor, who has responsibility of contacting the regulator if the council thinks the trust is in breach of its licence. But the rest of the duties of the lead governor will be taken up by active and interested governors. And there will be more information on the trust website in the near future about that too. So finally, I'm so sorry that it's not been possible this year to hold a real annual members meeting. I've such good memories of the last one, when our medical director demonstrated how the new 111 system was going to be working, and over 200 members attended and were able to question him directly. That 111 system has become virtually the single point of access to all National Health Services, making this trust crucially important in the whole integrated system of health and social care services in Dorset. Now, I've filmed this because everything's so unpredictable at the moment, and I wanted to make sure that I could thank the Chair, the Council, the Trust Secretary, the Board of Directors, and all of you for making my time as lead governor for Dorset Healthcare such a pleasure, and I will treasure the experience forever. Thank you.